welcome back to the Access California podcast. My name is Stephan Thomas. I am the Access Program Director, and I am here with
Stephanie Ramos, Education Director with Cal Voices.
And we are kind of continuing our conversation about some of our impacts. So this is another 2-part module podcast on this time centered around peer support, what it is. And then our second part will be having a discussion about what some of the modernization of the MHSA as it transitions to the BHSA, what some of those implementations will have an effect on peer support. So I think it's probably a good idea to probably talk about what a peer is and sort of what peer support might look like. So can you tell us a little bit about what a peer, what is a peer?
So when we talk about a peer, it means different things in different places, right? So if I'm a junior high student, my peers are going to be other junior high students, right? So we're maybe at a similar age, and in the moment we're having a similar life experience. And so when we're talking about lived experience, it's really about having a situation, a circumstance, something happen in your life that you have had, it left a mark on you. It has some significance in your life. It has had an impact on who you are. And so that's really like the lived experience piece. So again, if I'm a junior high school student, another junior high school student is going to be in a similar place in their life. When we're talking about recovery, and that could be mental health or substance use, we're talking about having a specific experience that has impacted my life. And if we look at certification, which we can get to down the road, is that there's kind of 4 main categories of peer support in the behavioral health field. So we have individuals who they themselves have experiences of recovery. So they've had mental health or substance use challenges, and they've been able to overcome that challenge. You have family members of an adult. So in my case, I'm a family member of an adult. I know what it's like to have an individual in my life who is having, mental health challenges or is dealing with issues in navigating the system and getting her needs met. So I know what it's like to be that first, person next to them, really helping walking them through that. And then we also have the transition age youth peer. So this is where we have somebody who has gone through some behavioral health challenges as a child or a young person or a young adult. And then we have the parent. So the parent of the youth, the parent of the child, it could be a caregiver, but somebody who understands like what did that look like when I was supporting somebody through the children's system. And so, peer support we see is very, it started from the grassroots. It was very informal, and we've kind of began to formalize it since we've implemented certification.
Okay. And so, like, for example, is it possible to have overlap? So let's say you're a transition age youth, which I think we identify as 16 to 24.
Ish.
Yeah. And let's say you're also a close relative. Can you exist in both peer spaces?
Yes. And so I think depending on who you're supporting, you're going to want to leverage that lived experience, right? So my ideal peer is going to be an adult of a family member, a family member of an adult who is having behavioral health challenges. I also have experience as the caretaker of a youth having those challenges. And so my peer is going to be those people. So for my sibling who has her own mental health challenges, her ideal peer is going to be somebody who is in recovery from having a mental health challenge, because they know, they know what it's like when someone's like, take a medication. They know what it's like, having to have a team of people that want to talk to you about your mental health stuff. Right. And so I think it depends on where people are working. So if I'm a transition age youth and I identify as a family member and I have my own recovery, if I'm working in the children's system, my ideal peer is going to be those young people. Right. If I'm working in, the adult system, my ideal peer is going to be those family members, right, who are assisting their family member. So I just think it's like, who is it that you're supporting, and do you have lived experience that matches that individual person?
Yeah, and we see a lot of this also in sort of the substance abuse recovery realms also. As someone who, is in recovery from both mental illness and substance abuse disorder, there are a lot of peer groups that sort of happen. There's things like the 12-step models, the non-12-step models, sort of outpatient groups. Those would all be considered peers because of that lived experience. Is that?
Yes, yes. And so what we've seen since certification is that with certification, it says mental health or substance use disorder, right? So it doesn't have to be both. However, I've never experienced a substance use challenge, right? My sister's never experienced a substance use challenge. So neither of us have that experience to say, you know what? I know what it's like to have a substance use challenge. I know where the hard parts are. I know what the easy parts are, and I'm going to support you. We don't have that experience. And the same on the other side, if you've primarily had a substance use challenge and weren't really dealing with mental health challenges, how do you understand that like involuntary inpatient setting when somebody had to go there involuntarily? And so it's not just about having lived experience. It's about, do I have lived experience that matches or as closely matches the individuals that I'm serving?
Yeah. And I mean, I know for me, especially with having both of those recovery pathways, there might be some theoretical overlap and maybe some actual literal overlap, but the peer model is actually very different when it comes to those types of recovery. Not the model itself, but the pathways to recovery are pretty different.
Yeah. So like peer support is peer support. Like regardless of like if you're talking about diabetes, if you're talking about substance use, if you're talking mental health, peer support is peer support. Now, the culture of those systems may be very different, right? So if we're looking at the mental health side, we often hear like, oh, this is something that happened to you, right? And when we look primarily on the substance side, it's like you did this to yourself.
Yeah.
And things are changing. I don't want to say like that is the way it is, but generally like that is the culture. And so, you want to know do I have that experience? Because I need to understand the culture.
Yeah.
Now, how I provide peer support, the core competencies are the core competencies, and evidence-based practice is an evidence-based practice. So that is going to be the same, but the context in which I provide it may be different.
I see. So those core competencies are pretty universal, regardless of if you're a person with lived experience or let's say you are a parent of someone with that's experiencing, SMI recovery.
Somewhat, right? So, and this is, I think, really hard. This may be hard for some people to hear, but, when I see, families supporting people that are having like severe challenges, sometimes we take on that identity.
I see.
Like,
sure.
Oh, like it, I mean, and we sometimes put to the side our own needs, right? So as a family member peer, my role is to say, hey, you're doing all these things, but how are you coping with this? Like, are you engaging in self-care? Are you engaging in support? What are you doing? Like, let me share with you what I did that really helped me, stay in this marathon, because I think for myself, like I'm very fortunate and I think fortunate for me, not always so fortunate for my sibling, but we like wrapped her in a bubble, right? So it was like, you're protected from the world. So we did all of this stuff to support her, often to meet our needs. We put you in a bubble because I don't want you to get hurt. I'm worried. I'm scared. I'm nervous. I'm uncertain. I need like consistency. I need predictability. I need things to go a certain way. So we are going to control your recovery as a family. With the best intention, now we have like kind of gotten in the way. And so I think for peers as family members, like I have to share like, the best way I explain it is like we all have a line. You put a line in the sand, and some people, at some point they'll be like, well, they crossed the line. Like I can no longer be a supporter because they crossed the line. And so I always look at it as, how am I regularly engaging in self-care and taking care of myself so that line is always getting pushed further out? I'm doing the work so that line isn't so close to me, right?
I understand.
And so as family member peers, that's really our role, is like really supporting people and getting the support they need so that they can continue in that marathon and not get burnt out, not have someone cross that line, not have like, I have to step away from this because now it's too much. And sometimes it's because like, they're like, it's not about me. And I'm like, but you just spent 2 hours on the phone. Talk about how horrible this is and how difficult it is and how like, yeah, you're not in the situation because of you, but you could actually make the situation work so much better for you and have such a healthier situation if you do the work too.
So I take it there's not a there's not a version of Al-Anon in the mental health mental health setting.
No, and
sounds like some of the same principles almost.
Yes, and it's it's a very scary place to be, and I think on either side, right? If it's on the substance use side or the mental health side, and you care about somebody and you see them struggling, and you're seeing these potential consequences come down the line. These negative experiences happen. Like we love our loved ones. We don't want that to happen. And so we kind of like jump in to rescue them.
Yeah.
And then we kind of
and then you get kind of pulled with it.
Yeah. If we don't have good boundaries.
Yeah. And having good boundaries is a developed skill.
Right. And so and so for me, I feel like that's why peer support is very important for family members, like for somebody else who gets it. And I think just like in the firsthand experience of a peer, I think it's very similar on the family member side, where when they talk to someone who really is a family member, they'll be like, oh my gosh, you really get it. Yeah. Like you really understand, because one of those things, and just like in people's own recovery, if you haven't been there, like you can't really understand it.
So you wouldn't say then that a peer with lived experience of being in recovery themselves cannot effectively support, let's say, a family member of somebody who's in mental health recovery?
It would not be ideal.
Okay.
And part of it is because like it's sometimes difficult to like fully empathize with somebody when you haven't been in their shoes.
I see.
And the experience is different.
And I think that works both ways, actually.
Right. Like we both saw the same thing happen, but we experience it two very different ways. And so I think the hard part with that sometimes is that who's applying for the jobs, right?
Yeah.
And unfortunately, there's still a lot of stigma within the behavioral health system around people being in recovery and working in the system. So I may, as an employer, think it's a lot less risky to hire a family member than it is to hire somebody in recovery.
Right, because they're not the one personally afflicted in that, like they're in recovery. Mm-hmm. There's a bit of a separation, I guess. Mm-hmm. Okay, so there's a part of that stigma that I think we talk about in, as a peer itself. Okay, tell us a little bit more about like what it's like to become a peer, like in terms of like a peer support specialist realm. What is that?
So it's ever changing. I actually started as a youth peer. I won't say what year to date myself, but it's been a long time. And back when I started, there was no training. It was like, here's your computer and your desk. Like, good luck.
Okay.
And so it was like your life experience was your whole training, which was like, okay, there were some things I understood, and there were some things that didn't scare me because that was normal. But it was also like, well, like I'm working on a team with all these people. Like, what is my role here? Or I really want to rescue this youth right now, and I had no boundaries training.
Right.
So I look back and sometimes cringe at choices I made as a youth peer, but it really wasn't because I was a youth. It was because I had I'd been very little guidance or training about like, well, what exactly is this role? And how do you do it in a way that's evidence-based? Yeah. So I think, again, this came out of a grassroots movement. There was no evidence-based. It was like, we're just supporting each other. But over time, an evidence base was created. Like, this works. We see it work. And so now there's like more training, and there's different types of trainings, right? So we have your like certification training that a lot of people are going through right now. There's intentional peer support. There's wellness recovery action plans. There's like a variety of methods and tools that people use in peer support. And so I think for a lot of people, starting off as a peer isn't something that you go from like, I never worked in this field before, and now like I'm a peer in the workforce, which happens, right? But there's also, some organizations have done really good job of creating like career ladders for people. So I know locally we have some programs that have peers working in their clinics. They also operate wellness centers, and in their wellness centers, when they see certain members showing up all the time, they're going to say, hey, we know you're here all the time. You have a really good relationship with the people that come in. Would you be interested in being an official volunteer at the center? Right. So then they're like still, really providing that authentic, from the community, pure support to other people. And they're also getting opportunities to like build their skills to the point where it's like, oh, you've been doing this for a while. You've been like helping us facilitate support groups. You've been running the cafe. You've been doing these things, welcoming members. Now, we think you're ready to maybe become like a part-time mentor.
Yeah.
And then, folks are getting further along, and then it's like, oh, we have full-time positions now. And that like ladder works for doesn't work for everybody, but it's thinking about like, how are we creating entry points no matter where you are in your recovery for you to like look at using your experience to support other people. And so that, it varies by agency, county, programs, things like that.
Sure.
But I think getting into it there's becoming a lot more options on how you get into it. And I think part of that is because there are so many different types of programs and roles that peers can work in now.
And so correct me if I'm wrong, there's 2 certifications, right? Is there a state certification and a Medi-Cal certification? How does that?
No, so it's one certification.
Okay.
And so basically like you have to like meet certain qualifications, like being 18, having a high school diploma, agreeing to abide by the code of ethics. And then you have to take an 80-hour training.
Okay.
And so that training has to be provided by an approved training provider.
Okay.
We have a certifying body in California that runs, I believe, most, if not all, of the certification in the state. They're called CalMesa. And so in order to provide the training, you have to submit your training to them, and they vet your training. They tell you what you want to change. They want you to change, and then you provide that. So, and then once you take that, you take the class, you meet all the qualifications, you apply, you take an exam, and then you're certified. The thing though about certification that I think not everybody has totally like wrapped their head around yet is that certification is a county opt-in benefit. It's not like mandatory.
Oh.
Now you have counties that opted in that are saying, no, our county is doing it, so everybody needs to get certified. But counties don't have to do it. And so you have peers that do go down the certification path. And once they are certified, if they are working in a county behavioral health system as a county employee or a contracted provider with the county, so you're not the contracted provider, you work for a contracted provider.
Yeah.
They can bill Medi-Cal for peer services. Now, if you're not working for anybody and you're not certified, you can't bill for Medi-Cal. You can't bill Medi-Cal for your services. Right, sure. And so that's kind of, where there is limitations in who gets it.
Okay.
But then you also have programs or counties that maybe aren't requiring certification. So do you have to get certified? Depends on where you want to work, depends on like what you want to do. And, some people are going to decide they're never going to get certified, and that's fine. And some people will. And I think because of certification, there's becoming this like tiered system of who's certified, who's not, who's getting paid more, things along that line.
So CalMesa is sort of the regulating body, kind of. Okay. And so I'm actually currently in one of our 80-hour trainings, and there's a lot of really great information. What would you say, like for, let's say, the peer that is, or someone with lived experience, that is interested in getting into working as a peer or starting a career as a peer, what would be some of the advice you'd give them?
I would say like get a good understanding of what the job is. We've been doing our training for a long time, and some people get into the training and they're like, I don't really want to do this. And some of it is because like, we go into something thinking, oh, this is gonna be great for me. And then you get in and you're like, wait, maybe I don't want all that. So I think just kind of getting yourself familiar with the role. I know for myself, I did direct service for a long time. And then there was a period of time where I was like, I don't want to do this anymore. Yeah. And it wasn't that like I didn't care and I didn't any of that. It was that like I had mental health at work all day, and then I had to go home and have mental health all evening and night. And I was just tired.
Yeah.
So I was like, okay, I love this field and I care about the work and I want to be an advocate and I want to continue to do that. But I'm like, I'm just a little burnt. So I think just exploring it and figuring out, like, is this the right thing for me? I think training is a really good way to find out, like, do I want to do this work? I encourage people to get trained regardless, because otherwise we're out there winging it. We're literally like, oh, peer support. Great. I'm your best friend. I have lived experience. And we know that, like, peer support, again, can be very much like grassroots, you know, by the community, for the community, like this informal connection that we have, which I think is amazing. And we also have peers working in a workforce and within systems. And so finding out, like, what is right for you is important. You know, can you work full time? Or do you really only want to work part-time or volunteer? How does this going to affect your benefits? Right? Explore that. There are a lot of great opportunities available through Social Security. There's Ticket to Work. There's, like, all kinds of options for folks to be able to leverage their work and build a career while also still getting their Social Security and their benefits. So, like, exploring, like, how is this going to impact me if I actually turn this into, like, a job? How am I going to maintain my own, like, recovery, wellness while also supporting other people? Right. So we talk about, like, walking the walk, which we're doing, especially if you want to be in a peer role. But then it's like, okay, this job may create additional stress. What are all the tools I'm going to put in place for myself so that I'm not putting myself in not such a good place? Yeah. And I think the same thing for family members too, is like, this is a lot, especially if you're supporting other people, and, like, is this right for you? So you may have people with lived experience that are awesome, amazing people, whether they're family members, parents, you know, if they're the individual in recovery themselves, but it's going to find out, like, what is right for them, what can they commit to, what kind of setting do they want to work in? Yeah. Like, some people are like, I only want to work in a wellness center. Like, I want to be very, like, community connected. I want it to be very organic. Like, I don't want this formal relationship that sometimes we see in more clinical settings.
I was going to say very clinical.
And some people, like, they want to go work in an inpatient setting. And other people are like, I wouldn't touch it with a 10-foot pole. So you have to find out, like, what kind of setting are you comfortable being in? And some people, you know, want to go to those, you know, more difficult environments because they're like, I want to make a change, and I have the tools I need to go make a change in this environment. So it's very personal, I think. And also, like, you want to personalize as much as you can the type of peer role that you go into.
Gosh, I have so many questions. So speaking of the workforce, right? Let's say you have let's say you have, like, a medical case manager, or let's say you have a clinician who's, like, your therapist or your psychiatrist, and they also have lived experience. Can they still fit in that same peer role?
Not if they're your clinician. So, and it's because of the power dynamic, right? So if Stephan, if you're a therapist and you have a neighbor who's, like, struggling, like, you're not their therapist. So you could be, like, their peer in a lot of ways, because you're like, I'm just coming at you like I'm your peer. I'm not trying to diagnose you. I'm not trying to assess you. I'm not, like, that's not our relationship.
Right.
Now, if I'm a therapist and I'm seeing somebody and I'm literally providing them with therapy and potentially clinical support, like, that's not a peer service.
Yeah.
And so it's not that, like, I always tell people, I'm like, oh, you're a peer. Yeah, you're a peer on your community, but at work, you're not a peer, because that's not your job.
Right.
You do assessments. You can 5150 somebody. You can, like, you're evaluating people. You're looking at their symptoms. You're prescribing. Peers don't do any of that. So yes, you can have lived experience and not be a peer in your workplace.
Okay. See, that's really good to know, because I think from the clinical side of it, especially, you know, knowing that I am a peer, and, you know, being a budding psychologist, you know, one, this is a complete lesson in codependency and boundaries, right? But also, like, understanding and being aware of those social power dynamics, especially when it comes to something as sensitive as, you know, if someone is you know, experiencing suicidal ideation or is in a crisis, and what that power dynamic looks like, where you do have the ability to 5150 or call emergency services. And I do hear that, you know, some folks really aren't ready to know that they're codependent, right? And I think it's true.
It's hard. It also becomes part of our identity.
It is, yeah. It is.
Like, if you're not totally dependent on me, like, what am I doing?
What am
Like,
I doing?
this is who I am.
Yeah.
I fix things. You come to me. I make it work better. Like, that's
Right.
who I am. And if you take that away, then what am I left with?
And my identity is challenged. Who would I be without my
Yes.
codependency? And the thing is, I think we fundamentally want people to recover and feel better. And I think, there's a part of us, like I know when I, as a peer, see someone, kind of connect or, feel these like, small successes happen for them. Like I get really warm and I want to experience that more. So I want to help other people. And then, we run up against some weaker boundaries there.
Like, whose need am I meeting right now?
Yeah. And which is really
and
mine.
that's like but I think that's like across the line in any helping profession. Like, who am I helping right now by doing this? Whose need am I meeting?
I mean, I became a therapist so I can heal myself. I mean, others too, but
right. You're like, let me figure all this out.
This is really me trying to figure me out through others.
Yes,
I'll help you too.
Right.
Very cool. Well, and is there anything else that you would want folks to know about being a peer, how to get started?
I mean, there are, go check out your local wellness center. Like, see what's going on there. I know in Sacramento we have like 11 wellness centers. You got options.
Yeah.
And different places do things differently.
Sure.
So, get familiar. I know that at Cal Voices we operate the California Association of Peer Professionals. It's www.californiapeers.org. We have quarterly meetings talking about like what's going on in the field, what's relevant to peers, and connect with people that do peer support and find out like what are the great parts of it, what are the hard parts of it, like where does it feel good, where does it not feel good.
And this is open to public. This is open to everyone.
So the association is open to folks who are certified, not certified, working or volunteering in peer roles, or if you're interested, like if there's something that you want to check out, like our membership is free. So we definitely encourage people to sign up and learn about what's going on. Cal Voices, we got your podcast, so we got to listen to the podcast. We check out our website, calvoices.org, kind of see what we're doing. We got social media, Instagram, Facebook, all that stuff.
YouTube, Spotify and SoundCloud.
All of the ats.
We are very hip.
Yes. And there's just like, you can Google like peer run organization in California and a bunch of agencies will pop up. And for those of you that don't know, peer run is basically like our agency is run, operated, staffed by people who are in recovery or their family member. So I didn't, I only got to work here because I have a sibling who has severe mental health challenges. And so it's like a minimum qualification.
Yeah.
But I will tell people that, to be a peer, be in a peer role, lived experience is required but not sufficient. Lived experience is a minimum qualification. But what about the other things that we need, right? And so, and that depends on where you want to go with peer support.
Yeah.
Like if you really want to stay in kind of like that informal world of peer support, where it really truly is grassroots, you're connecting with people at a different level. Like if you could use a computer, maybe it doesn't matter, right? But if you're in like a more formal setting providing peer support, like you may have to bill Medi-Cal in an electronic health system. You have to like abide by certain like policies and procedures in your agency. You have to abide by the code of ethics for peers. And so it just really depends on what you want. And then finding like what's going to be a fit for, really, what is a fit for me? Yeah. Right. Not only like what do you want to do? What setting do you want to be in? At what like level do you want to be involved in this? Like there's
what's
a lot
my capacity?
Of things. Right.
What's my capacity? And also what is my skill building capacity? And and that's a part of it is building those other skills, which careers are completely possible with peer support, the workforce. So, it sounds like there's quite a large spectrum. Well, cool. Thank you so much for having this chat with me. I do appreciate the time. We are going to have a part 2 of this where we're going to talk about, we're going to revisit sort of modernization and then talk about how that will affect the peer support specialist realm or the peer workforce. But until then, thank you so much, Stephanie.
Of course.
And make sure to like and subscribe. I love saying that. And we'll see you next time.
Awesome. Thanks, everyone.
Bye.
Bye.